Good morning. My name is Gavin Paterson and I'm from the Health and Social Care Alliance Scotland. I'm the Development Officer for Self-Management there. I'm very excited to be here this morning talking to you through this video. I have to apologise for not being able to be there in person actually, but thanks to Claire and Lorna for allowing me to still be here through the video. Now I'm going to speak to you first of all about the Health and Social Care Alliance in general, for those of you who don't know who we are. I'll then touch on the Self-Management Partnership and Practice Programme, and then I'll go on to expand a bit on the 5 principles of self-management. So the Health and Social Care Alliance are a third sector intermediary, which is really a fancy way of saying we're a charity set up to represent the views and interests of other charities. Now, the Alliance began in 2006, and since then we've got almost 900 members. Now, interestingly enough, the Alliance was originally set up because of self-management. A group of people with interest in self-management, people with long-term conditions and their carers, and organisations got together to make sure that self-management was at the heart of health and social care. Now, like all charities, the Health and Social Care Alliance, we have a vision for the future, which is seek to build a Scotland where disabled people, people with long-term conditions and their carers have a strong voice and enjoy the right to live well. So what do the Health and Social Care Alliance do? As you can see from the wheel here, I don't know how clear it is to you on the screen, but we have a number of projects and initiatives based at the Alliance, and they're all focused around the 2020 vision for health and social care. For example, research has shown that health and well-being is improved through having access to local information and support. However, our previous work at the Alliance indicated that this access wasn't as easy for people, particularly people with long-term conditions. We were also hearing as well that health and social care professionals wanted to find out what was in the area for the people they were supporting. Therefore, the programme called Alice was born, which makes finding these local sources of support easier for people with long-term conditions and the professionals who are supporting them. We also have, of course, the Link Worker project, which I think you'll hear about later on this morning. And we have our project, which is the Self-Management Partnership and Practice project. Now, I'd be here all morning literally talking about all the projects and programmes that we have, but I would genuinely invite you to have a look at the Health and Social Care Alliance website. We've got loads of literature and information on there about the projects. And really, we would like you to see us and use us as a valuable resource of information in terms of self-management and health and social care in general. So the Self-Management Partnership and Practice Programme, which I understand is a bit of a mouthful in itself, the programme grew out of learning from the Self-Management Impact Fund for Scotland. Now, the Impact Fund for Scotland is a grants-based programme whereby small and large organisations can apply for grants to set up or develop initiatives that support self-management. Now, to date, there have been 180 projects supported through the fund, so that's a lot of learning that we've built upon already. And the Self-Management Partnership and Practice Programme would like to build upon that learning. Now, for our programme, we have 3 main aims, and that is to share learning, develop practice, and support partnership, and that's to enhance the reach and scope of self-management in Scotland. So in the last few months, we've been undertaking a scoping exercise in relation to self-management, just to see what the landscape was in a national sense of self-management. And in doing so, we learned quite a lot from the scoping exercise. We involved people with long-term conditions, carers, health and social care professionals in the scoping exercise. So I'm going to quickly touch on some of the key learning that we drew out of the scoping exercise. First of all, health and social care professionals must have a person-centred approach. It's basically all about that self-management conversation. And by conversation, we talk about we want health and social care professionals to feel confident and enthusiastic about having that conversation self-management conversation with the person with long-term conditions and, in fact, their carers. And this is what the people with long-term conditions want as well. They want the health professionals to have that conversation with them. Self-management spreads more so through word of mouth. We have what we call self-management champions, which can be people with long-term conditions who have self-managed successfully themselves. And we have health and social care professionals who have seen the positive difference that supported self-management can make. Coming from my own point of view, being someone who self-manages, it's very difficult not to be a champion of self-management once you see for yourself the difference it can make in people's lives. One main barrier to self-management turned out to be confidence and self-esteem. Somebody with low confidence or low self-esteem tend to find it difficult, clearly, to go to any peer support groups, to seek out further information for themselves, but to also ask questions when they're at the GP surgery or hospital appointments. And people with a high sense of confidence and self-esteem seem to naturally gravitate towards that self-management approach. Reflection facilitates self-management learning. Now, the people with long-term conditions and their carers have told us that reflecting on their self-management, reflecting on that journey of self-management has been intrinsically valuable to them. There's something empowering about not only self-managing, but realising that you're self-managing and being able to take a step back and look at your journey of self-management. Culture, the word culture came up again and again and again through people with long-term conditions, health and social care professionals. The culture at the moment is still not conducive to self-management, and it's something that we've been working on and a lot of people have been working on for a good number of years now. However, the culture is still not as up to scratch as we would like it to be. It is changing, but there's still more work to be done. Education, again, that's why I'm thrilled to be here, because how do you change a culture? You change a culture primarily through education and training. So we would like to see more education in terms of self-management modules being included in health and social care professionals training. The relationships are at the heart of self-management. And by relationships, I mean the relationship with someone with long-term conditions and their clinician, the relationships with their peer support group, with their friends and family, or their carer. Relationships in general seem to be at the heart, still at the heart of any self-management support. As I said, there's great work being done already in terms of all these key learning that I've listed here, but we found that more still needs to be done. Now, an interesting aspect of the scoping exercise revealed to us that the 5 principles of self-management, as set out in the Go On Yourself, the National Self-Management Strategy for Scotland, these principles were brought about in 2008. Now, Go On Yourself, interestingly enough, it's a Scottish Government document, but it was not developed by the Scottish Government. It was developed by the Health and Social Care Alliance. Now, the key meaning of this is that the people with long-term conditions and their carers are at the heart of that document, and it's a document that's written by them. Therefore, during the scoping exercise, we asked people, do these 5 principles still apply to you? To which there was a resounding yes. And I think because the people with long-term conditions have come up with these 5 principles themselves and supported them so well, it's these 5 principles that we really must adhere to and learn and passionately talk about as much as possible. Now, before I go on, if you can take a look at Go On Yourself, the document. It reads incredibly well. It's very easy to read, and it has everything you would need to know about self-management in one document. Now, within that document, there is a paragraph about what self-management actually means, and I think it sums it up quite well, so I'll quickly read it to you just now. Self-management is a concept where the person takes ownership and is central. It is a process of becoming empowered to manage life with long-term conditions. It is not an individual action, a specific treatment or service. Neither can it be delivered by a single organisation. Self-management is a successful outcome of the person, all appropriate individuals and services working together to support him or her to deal with the very real implications of living the rest of their life with one or more long-term condition. So the first principle of self-management: be accountable to me and value my experience. Now, whether you're a GP, a community care worker, a nurse or a social worker, you need to be accountable to that person with long-term conditions and value their experience. Now, interestingly, the Oxford definition of accountable is actually required or expected to justify actions or decisions. So if you think that in terms of being accountable, it's a very strong definition. Now, there's a saying that goes around in the world of self-management that the health professional is the expert in the condition. However, the person is an expert in their life, and it's these two expertise brought together that form the solution, which is self-management. Now, as health professionals, spending time with people with long-term conditions, you realise that in comparison to that person's whole life, the time you spend with that person is minuscule. So naturally, you need to take into account that person's experience. However, this principle doesn't just ask you to take this into account. It asks you to value the person's experience, and value the person's experience as much as you value your own knowledge and skills. If you value someone's experience, you empower that person. You give that person hope, and you give that person a sense of control. Empowering that person by putting them in the driving seat of their long-term condition. I am a whole person, and this is for my whole life. When you're first diagnosed with any long-term condition, it's very difficult to come to deal with. You're faced with the fact that this isn't a cold or flu that's going to disappear in a week or two. This is something you need to live with for the rest of your life. And health and social care professionals need to be mindful of that it's for the person's duration of their whole life. Also the fact as well that you need to take into account the person's whole life. It's not just a quick fix. Self-management isn't just a quick fix. It's a journey, and it's a whole of life journey. For example, asking, what does a person enjoy doing? For example, I was diagnosed with kidney failure in my early 20s, and I was put on dialysis. I was very unwell, and I was what you would call a non-compliant patient. I didn't comply with virtually anything. I didn't take my medications. I didn't turn up for appointments on time. I wasn't eating the restricted diet that I was supposed to be eating. And I just wasn't interested in complying. Now, I knew the risks that this was taking. However, when I was diagnosed, interestingly enough, I was a health and fitness student. And all that mattered to me at that moment in time was health and fitness. That was my world. And I felt like my world had been taken away from me. Therefore, this telling me to take medications was completely irrelevant. If somebody had had that self-management conversation with me early on, they might have been able to figure out that this was the reason for my non-compliance. For someone to tell me, wait a minute, you can still go to the gym, you can still play football, it would have then given me a reason to take my medications and to show up for the appointments. And that is how you look at someone in their whole life. Self-management is a journey, like I keep mentioning. For someone who attends an appointment, if someone takes their medication, that is self-managing. For someone to go to a peer support group, find out further information on their condition, and, for example, take up regular exercise, that is also self-management. What might seem like a very small step for us can be a massive step for someone else. Anyone can self-manage. I am the leading partner in the management of my health. Someone with long-term conditions should feel part of a team. Not only part of a team, but they should feel like they are the leading partner in that team. If you involve someone, you give them the confidence to keep well. You give that person a sense of responsibility. Now, on the Alliance website, there's a link to another program, a self-management awareness raising program called My Condition, My Terms, My Life. Now, on that website, there are loads of real-life examples of people self-managing successfully. There are also examples of professionals supporting people to self-manage. So that's definitely something worth checking out as well. Now, on that website, there's a story about a gentleman called Frank. Now, Frank has multiple long-term conditions. He describes being the leading partner, I think, very well. He talks about being the hub in a centre of the wheel, where the spokes coming out of that wheel are the health professionals, social care professionals, friends and family, peer support group. And I think that sums up how the leading partner in management of their health should actually be. I had a terrific experience as well of being the leading partner. Several years ago, after I had a successful kidney transplant, I had severe stomach pains that came suddenly. Now, for several months, I was going back and forward to the doctor, and they couldn't find out what was wrong. I was given different medications and nothing would work. And I began losing a lot of weight. I was very depressed by this. I became despondent. And eventually I went to see one of the transplant specialists. Now, he sat me down, and the first thing he asked me was, what do you think it is? What do you think the problem is? And I was quite taken aback for him to ask me this, and I didn't quite know how to take it. But anyway, I told him that I'm on so many medications now. Could it not be something to do with the dosage of my medications? So he ended up calling in another doctor, and the three of us were having a discussion. He called in the pharmacist, who happened to be just outside wandering about, and the pharmacist was brought into the conversation. Now, here was the four of us having a conversation about my long-term condition, about this problem. Now, not once there did I feel like a patient. I felt like the leading partner. I felt like I was involved in a roundtable discussion about my health. The problem was, to cut a long story short, the problem was solved, and it turned out to be my medication, incidentally, anyway. But the empowerment, the sense of empowerment I got from that, and the sense of renewed responsibility, I felt a renewed responsibility that, yes, of course, I'm in charge of my health. With support, I can be the leading partner in the management of my health. Clear information helps me make decisions that are right for me. Now, imagine for a second you're diagnosed with Parry-Romberg syndrome. How do you control your symptoms? What do you do? I mean, what lies in the future for you with that illness? Now, I'm sure a lot of you are already quite perplexed by that, because I don't expect you to know Parry-Romberg syndrome is a very rare condition that infects the soft tissues of the face. However, that's irrelevant. Someone with a long-term condition being diagnosed with epilepsy, ME, diabetes, a diagnosis like that can be just as perplexing. Therefore, clear information is vital for that person to be able to self-manage. Professionals should ensure that the person understands the information and the information is accessible. That's really the health and social care professionals' role in this. In terms of health literacy, going back to that conversation I had with the doctors, they knew there would be things and terms that I wouldn't understand, but they clearly explained them to me. And we need to be mindful in terms of, there's a lot of work being done in Scotland in terms of health literacy just now, but we need to be mindful of that as well. Also, the information must be given at the pace and stage of the individual. There's no point in bombarding someone with information when they're first diagnosed, because most of it will go right over their head. However, being an individual, some people might prefer that. So it's about looking at the person as an individual, having that person-centred approach to giving information. Now, last but certainly not least, self-management is not about going it alone. Of course, it's the individual's responsibility to self-manage. But in terms of be giving the information, the skills and the confidence, people need support to self-manage in those terms. Again, it's the individual's responsibility to self-manage, but in terms of supporting that individual to self-manage successfully is in fact everyone's responsibility. Now, those are the 5 principles of self-management, shortened down for the purposes of this film, but like I said before, the important thing to remember about these principles are they were written by the people with long-term conditions, and they're what matter to them. They're still as relevant today as they were in 2008. Now, if you can learn these principles, follow these principles, and even share these principles in your practice, I guarantee you will change people's lives. That the principles are there to do that, change people's lives, because that's ultimately that's what self-management comes down to, is changing people's lives, improving people's health and well-being. I'd like to quickly touch on the Self-Management Network Scotland. Now, the Self-Management Network Scotland has been established as a national learning network for self-management to share practice, to share views and ideas in terms of self-management, so that we can build on the learning that we've already had. We want to bring together a range of self-management knowledge and experience and share this throughout Scotland. Now, as of the 5th of January, we had 165 members. The more members we have, the more skills and experience that the network has. So I would urge you to have a look at the network and join the network. There's no hidden cost as well. Lastly, you might think that by doing this via video, I've wriggled out of any difficult questions that you might be interested to ask. However, you should be getting hopefully my contact details while you're at the lecture this morning. So I would hope if you have any questions at all, please don't hesitate to get in contact with either myself or ask through the Self-Management Network Scotland, and we'd be happy to help, because that's what we're there for. Thank you very much, and I sincerely wish you all the best in your future practice.